Cellular therapy is a new treatment option for leukemia, lymphoma, and multiple myeloma.
It's designed to reprogram your own cells to fight cancer and increase life expectancy. UI Health offers different types of cellular therapy and is continuing to work on more innovations. Dr. Carlos Galvez joins us with more. Doctor, thanks for being here.
Hi, absolutely. Thank you guys so much. It's an absolute honor being on.
We're excited to learn about this because when we talk about cellular therapy, what exactly does that mean? I mean, we've hinted on it a little bit.
Yeah, so as you very astutely mentioned, this is a relatively newer field and a very rapidly evolving field where we can provide really curative options for a lot of patients with really resistant lymphomas, leukemias, and multiple myelomas were actually malignant blood cancers. And so this does provide patients with a lot of new hope in order to not only live longer, but live better. And so, so this is a very rapidly evolving field, and there's a lot that is going to come out in the short years,
So I think for people who have had cancer or have family members or loved ones that have gone through cancer treatments before, we're very familiar with radiation or with chemotherapy. But what does cellular therapy look like? What does that mean? What does a patient go through?
And that's a really, really good question. So cellular therapy is when we essentially take the live human cells, and instead of doing the normal function that they normally do, in the majority of cases we collect white blood cells, which are a very important part of the immune system. And they normally fight viruses and bacteria. But what we actually do is we re-engineer them, we reprogram them so that instead of fighting bacteria and viruses, they fight the cancer cells themselves. And so we use this so that we can collect and reprogram these cells so that we can then give them to the patient. And it's only with this that they can get very exceptional results, really, really good responses and potential cures depending on the type of disease that they have. And so this is, kind of a little window into the future of how this field is going.
And I assume if you're someone who's dealing with that type of blood cancer right now, you would come to UI Health, and do you start at the beginning and kind of go through all the options, or how does that work?
Absolutely. Phenomenal question. So typically when we see a patient in clinic, they've already been treated with multiple other lines of therapies.
They have,
yes, they have. And so the majority of these patients, especially if they didn't get cured the first time around from the treatments that they have, this is when they really approach somebody who specializes in cellular therapy to talk about some of these options. And so what we know is that before the advent of these type of treatments, the outcomes from some of these patients were not as good. And so now what we do is we initially harness the patient's cells, we re-engineer them, or we reprogram them to fight the cancer and then give it back to them. And so, like I mentioned before, this has been a very rapidly evolving field to treat very resistant type of blood cancers that previously were thought to be incurable or not able to be treated anymore, providing a lot of people with hope.
So it's saying that it may not necessarily be the first course of treatment, and there's still ongoing research that's happening. But I think when I think about blood cancers, a lot of times I think about children, like in particular with leukemia. So this is also something pediatric patients can undergo?
That is an amazing question here. So actually, CAR T-cell therapy is one of the types of cellular therapy, and it's actually become the most common cellular therapy that we use now in the United States. This was actually FDA approved in 2017 to cure patients with pediatric leukemias. And so leukemia happens to be 90% of all cancers in the pediatric population. And so this was able to provide great benefit for these young kids. And since then, we've actually expanded our use of this type of therapy, not only for lymphomas, but adults who have leukemias and other diseases like multiple myeloma. And so with these type of treatments, we're able to provide hope when previously there were not many options that we could have provided these patients.
It sounds like so much has been done just in the last several years. I can't imagine. What do you guys have on the horizon for what you see the outlook for?
Absolutely. And so what we know about cellular therapy is that it's a very, very good option for patients who've had these resistant types of blood cancers specifically. But what we know is it doesn't work for everyone. And we know that not every blood cancer can receive CAR T-cell therapy. And so really that's the foundation of where at UI Health we're really trying to understand, right, as to why not everyone responds to these treatments. And we actually have open clinical trials really investigating why this is and the things that we can do to improve on that so that the patients, whether they're pediatric adult patients, could get the best outcomes possible.
Oh, wow. Thank you so much for enlightening us,
please.
Doctor. And I feel like you did it in a very digestible way for us. Thank you so much.
No, please.
For more information, just head to uihealth.care or scan the QR code that you see there on your screen.